Hi everybody, for today's teaching video we're going to do a quick review of push-dose epinephrine. We're going to review how it works on the body, indications, and then give you a quick demonstration on how to draw it up and prepare the medication. Epinephrine is classified as a sympathomimetic drug. It works on both the alpha and beta adrenergic receptors. We call it an alpha and beta agonist. And the way I remember that is if something's in agony, you want to help it. So if you have an agonist, it's going to stimulate those receptors. Epinephrine works on the alpha receptors, increasing the heart rate and causing vasoconstriction. It works on the beta receptors, increasing cardiac contractility and bronchodilation. There are several different reasons we would want to give push-dose epinephrine. Primarily, we're going to give it for hypotension without tachycardia. This can be due to cardiogenic shock, patients with return of spontaneous circulation in cardiac arrest, anaphylactic shock, septic shock, neurogenic shock. As far as hemorrhagic shock, there hasn't been enough research to be pro or con, so be sure you follow your system protocols on when it's appropriate to administer the medication. Now, there are several different ways to prepare push-dose epinephrine. Everybody's going to have their own teaching method and way of doing it. I'm going to show you a method using a needleless system, but however you prepare the medication, make sure that you dilute the epinephrine appropriately, label your medication, and as always, follow your system protocols. So our goal is to create 100 micrograms of epinephrine in 10 mLs of fluid. To achieve this, you're going to need epinephrine 1 milligram in 10 mLs. You're going to take 1 milliliter or 0.1 milligrams of that epinephrine and you're going to dilute it in 9 mLs of saline. For this demonstration, I'm going to start with an empty 10 ml syringe and I'm going to attach it to a needleless locking system. I'm going to take my epinephrine 1 milligram in 10 mLs and I'm going to drop 1 milliliter of that epinephrine. I'm then going to disconnect the epinephrine and attach a saline flush. I'm going to take 9 cc's of that saline flush. I'm also remembering to hold on to that cap of a flush. It's going to come in use later. So here I'm drying up 9 cc's of that saline. After I disconnect the saline, I'm going to drop some air into that syringe. There should be space at the end of it. I'm going to put the cap on from the flush and I'm going to agitate the medication to mix it. So we've got 10 mLs of fluid with an air bubble so we can mix it. We're then going to label it right away so there's no confusion as to what's in the syringe. One of the common questions I get is why use an empty 10 ml syringe and not just waste some fluid from the flush and draw it directly into the flush. The reason behind that is the flush says sodium chloride flush on it, and if the label falls off or anybody becomes confused, they may end up using the medication as a flush through the IV, causing too much medication to be given at the inappropriate time, which is why I start with a 10 ml syringe and label it. So you've created push-dose epinephrine, 100 micrograms in 10 mLs, or 10 micrograms per milliliter. Make sure you reference your local policies and procedures for how much you should give the patient and when it's appropriate to administer it. Make sure you look out for potential side effects, including tachycardia, hypertension, anxiety, and palpitations. Always monitor your patient and reassure them. If the side effects become severe, consider adjusting or stopping the medication as appropriate. To sum up, push-dose epinephrine is a vital tool in our emergency response arsenal. With proper preparation and administration, you can stabilize your patient and improve their chances for a positive outcome. Remember, practice and preparation are key to excellent patient care. Well, thanks for stopping by. Make sure you click like and subscribe.